Fantastic. We're ready to roll. Welcome, everyone. Welcome to Medical Mondays with Dr. O. I am Dr. Tony Opeyemi, and my background is in family medicine, HIV medicine, and addictions. I host Medical Mondays with Dr. O, and I'm excited about the topic tonight because our very own family of Medical Mondays with Dr. O, Dr. Opeyemi Adewole, is going to be presenting on a breakthrough research in oral health. And we all know, if you're a member of Medical Mondays with Dr. O, you know that dental health, oral health affects the heart. So that's why the topic tonight is quantifying periodontal burden on cardiovascular health. Again, in plain English, quantifying oral health, oral issues, oral problems on cardiovascular health, that is the heart health. And we're privileged to have one of the authors himself, Dr. Opeyemi, who actually did this research, come to present to us tonight. So without much ado, I'm going to yield the floor to Dr. Adewole Opeyemi. The floor is yours, and welcome.
Thank you, Dr. O, for the this great opportunity to come one more time on Medical Mondays. It's been another opportunity to learn, contribute, and to gain one or two things in this university. I usually call this a Medical Monday university, and I really appreciate previous. Can you hear me, please?
Yes, we hear you clearly.
Okay. I appreciate various contributions on contributors on this platform. Today, we come again with more awareness on oral health. We keep drumming the importance of oral health as much as possible for us to understand that a whole human body, oral health is also a major part of it. So today, I'm going to be looking at the quantifying a periodontal burden on cardiovascular health. This is like a follow-up presentation to a narrative article that we had in that we published this last month. When we look at the title of the original article is periodontal inflammation, a clinically significant and under-recognized cardiovascular risk factor, to form endothelial risk score. This I will show us the article as we go on. Now, we have mentioned on several occasions like this that periodontal disease, which we also known as gum disease, is one of the major bacteria disease of bacterial origin that actually affect the tooth structures. And if this gum disease is not managed on time, it could lead to tooth loss and also affect some quality of life, like chewing, even aesthetics, the way the facial appearance, it affects it. Now, beyond this, we know that the inflammation that cardiovascular periodontal disease had actually affects a lot of individuals. 50% of adults worldwide are affected, with about 11% suffering from the severe form. These severe forms are the ones that are really associated more with other systemic diseases like diabetes mellitus, respiratory diseases, cardiovascular diseases, Alzheimer's diseases, arthritis, and all those things. And when we look at 11%, of a population, of a global population of adults that has severe form of periodontal disease, we realize that this is a very significant public health, a disease of public health importance that we need to actually look into. But, more studies many studies have been done in the past. The group that I also belong to, this is a periodontal medicine group. And with all the plethora studies that have been done in the past, observation study, intervention studies, to find out the association between the periodontal diseases and the systemic diseases. One of the things that is very, very glaring with some of the two entities is the fact that the chronic inflammation that is occurring, the process of chronic inflammation that is similar in periodontal diseases and also in the systemic diseases. Most of the time, what we can say is just that, oh, there's a link between periodontal disease and cardiovascular disease or diabetic mellitus and all those. There's a link. And this link, now, when we institute a treatment, we can see that, okay, maybe there's an increase in the clinical outcomes of the patient. Maybe their condition improve a while or thereabouts. But there are certain questions that we were not able to answer, especially when clinicians ask us, what does it mean? What does this improvement mean? Or how will I be able to know what it is, what you have treated that have contributed to this improvement? So some of these are created a kind of a gap. So most of what we have is just a qualitative link. And our group has we deliberated on the issue of if it's possible for us to get a qualitative link, something that a quantitative measurement that is possible to measure the impacts of periodontal inflammation on all other systemic diseases. Going through the literature, most of the time, the studies that we have were just basically they are not quantity. They were not quantitative measures to quantify the importance of the burden of periodontal disease. So eventually we come along with this periodontal inflamed surface area, which is called PISA, and it was incorporated into the already existing cardiovascular risk frameworks. Now, when we want to explain what is actually how does systemic disease, periodontal disease, actually lead to systemic diseases? The three plausible explanations are the fact that bacterial invasion. There are some virulent bacteria that directly invade the surrounding tissues structure as time goes on, that when they create what we call holes around or pockets around the two structures, they break down the tissues. And by the virtue of the toxins that they produce and release, they kind of form the human body, the human tissue respond into these toxins by what we call tissue destruction. So as this is going into the bloodstream, they tend to also affect the epithelial cells that are lining the blood vessel. And the second concept is the fact that systemic cytokines are being released. When the pocket the pockets are epithelial pockets are ulcerated, they act like endocrine-like organs, spilling into the bloodstream some factors, cytokines, like TNF alpha, interleukin 6, C-reactive protein. This is continuously spilled into the blood circulation, and eventually they contribute to what is called low-grade systemic inflammation. Another thing that actually explain more on the issue of the cardiovascular condition is endothelial dysfunction, because as a result of the toxins that enter into the bloodstream, they affect the endothelium and make it reduce the production of nitric oxide, which is also very important for the vasodilation and of the blood vessels. So with this, these are the possible explanation in the literature, whereby we can have the link between the periodontal disease, periodontal structures, and the systemic circulation. Now, when we look at this picture, this is the picture that really depicts it more. On this side, we have a periodontal health. Periodontal health, when there is everything is normal, you can see that you can see the epithelium, you can see the bone. These are the supporting structures. But when there is when there are disease, periodontal disease, the gum will begin to get inflamed, ulcerated. And when it is ulcerated, you can see there are a lot of plaque around this side. When this occur, there's a break. There will be some break of this tissue. As it is on this side, there's a break. When this tissue break down here, you have a pocket that gets deepened and deepened. And by the time it gets to this level, is an open entry to the blood flow that enter into the circulation. So what happened is that there's a lot of inflammation ongoing around this junction area. So the periodontal inflammatory inflamed surface area is what we have found out as a tool. Of course, the tool has been there in dentistry for some over 5 years now. That it was discovered around 2017, but it has not been incorporated into the systemic disease. So that's the essence of formation of this endothelial risk score, which is going to be used to quantify the periodontal burden of periodontal burden on cardiovascular tissues. So, like I said, periodontal inflamed surface area is that portion that has been affected by tissue, by bacterial origin, that is having direct contact with the capillary system. Now, we know that cardiovascular diseases is one of the major another major disease of public health importance because of various morbidity and mortality that has been associated with that. Most common cause of death in US, according is accounting for over 30% of all deaths. You know, coronary heart disease is the most common cause of atherosclerotic cardiovascular disease. And you see, strokes occur 1 in every 21 deaths in United States in 2020 ranks 5th among all causes of death. So what we are saying here is that the importance of cardiovascular disease, that machine that pumps blood, is very, very important for us to take care of it, because the disease burden on it can affect so many things if we are not being taken care of on time. A study, so various studies have been done, but this is just one of them to restore vascular health. A clinical studies established that periodontitis patients exhibit 4 to 6% of absolute reduction in flow-mediated dilation. Flow-mediated dilation, which is a key metric of early endothelial dysfunction. Like we earlier explained, that endothelial dysfunction is one of the first things that we usually notice with the bacterial invasion of the bloodstream. Eventually, if it continues, it will lead to what we know that is called atherosclerosis, whereby we have a formation of some solid plaques around the lining the endothelium, and eventually blocking the flow or normal flow of blood to other parts of to other area or to the end organs. Interventional trials demonstrated successful periodontal therapy and significantly restore this flow-mediated dilation. So what we are saying here is that studies have shown that when periodontal treatment is instituted, we tend to have some of this flow-mediated dilation being reduced, and at the end of the day, it's improve the rate at which the blood flow in in the tissue. And then when we see that this heart tissue is very, very important in the sense that it must not be blocked in any way. It is going to be any form of a blockage can occur from these vessels. You see these large vessels moving to the medium-sized vessels, and when when there is blockage as a result of this atherosclerosis, it tends to block the rate at which the blood, this machine pump blood all over the body. And then the endothelial risk score that have been formulated in previous study I'm going to show us is based on conceptual framework. Of course, is based on conceptual framework, based on the evidences that have various evidence that have been sensitized from, synthesized from other various studies that have been done in the past. And because it's while the traditional cardiovascular risk scores have been used to categorize the cardiovascular disease or to quantify the burden of cardiovascular disease, the aspect of periodontal component is always missing because they is not part of those tools. That's the reason why, by using heuristic principle, that periodontal inflammation could actually be incorporated. So one of the major tools that are now incorporated into the already existing cardiovascular risk scores is the PISA that I mentioned the other time, periodontal inflamed surface area. To calculate this surface area, it's actually a it's not something that it's something that we have to do involve some formula, which I'm not going to go into and this in this study in this discussion. But what is very, very important that I want to establish is the fact that endothelial risk score has now been in the online, but we have this. There's need for validation process to do these studies because I'm going to show us a typical of endothelial risk score so that we know various components that are being incorporated into this tool. And it is very important for us because this will help us to bring both the periodontology and also cardiovascular disease for now, for cardiology together. We know that with respect to diabetes mellitus, it has been established that there is a bilateral relationship between the periodontal disease and control of diabetes, glycemic control, which is very, very important. Meaning that if somebody has a diabetes mellitus, for example, and is just taking the maybe insulin drugs, oral hypoglycemic drugs, most of the time, studies have shown that their results, their outcomes are not as good compared to people that are combining their treatment with already established periodontal disease. So by using this score, is going to help the medical field to integrate the periodontology, and we will shift the treatment planning from just the binary treatment plan to more systemic calibration. For patients, other form of transitional value is going to be, it will be important for us to be able to explain more holistically to patients, and it will enable clinicians to clearly articulate the various severity in terms of the various severity of periodontal disease in terms of arterial health impact. Like I said, interdisciplinary synergy is also one of the benefits that we have as a result of if this tool eventually validated and incorporated fully is going to help in calibrating interventions and guide decisions on when to pursue intensive periodontal therapy, and especially to reduce cardiovascular burden. Hypothesis generation is the fact that we are moving from a form of we know there's we now know that there are associations, but we are moving to the realm that how much of periodontal inflammation is actually responsible for various, maybe the cardiovascular disease, the burden of cardiovascular disease that we may have. Now, this is the endothelial risk score. I'm going to show us is designed for hypothesis generation across population for pending empirical validation. It is complementary and not competitive with established cardiovascular risk factor. This particular calculator is now publicly available on this MedXY platform. This is a digital organization that immediately they saw this particular this article, they incorporated some of the findings and into their own to form this calculator. And it is also very important because it's showing that there's a growing interest in this field of periodontal medicine. And I'm glad we are glad to have this kind of initiative ongoing. And then, like I said, validation is still very, very important because most of the weighting system are based on the heuristic principles, not because we couldn't find any weighting system that can accurately be scientifically proven. So we have to use that. We have to use the system. I mean, the various the various risk factors and the scores that are available in the literature. So there is still need for validation. We have started a validation process in certain university teaching hospital in Nigeria, which is as have these phases. Phase one, it has to do with calibration of phase one has to do with calibration, where the PISA will be calibrated with, we validate PISA with flow mediated dilation, and the high sensitive CRP protein, which is a very inflammatory bowel cytokine and a biomarker. Phase two, we have to do with prospective treatments, when we are going to give patient treatments, and after that we measure the flow mediated dilation after the recovery from periodontal disease. And through these studies, empirical weights will be allotted, and the final phase will be to integrate it into various electronic health records. So I'm going to show us briefly run through the article, and if 1 minute. So this is the article. You know, are we seeing? I'm sharing the article.
Not yet.
With us. Okay.
And to reiterate, periodontal disease is gum disease.
Yes, ma'am.
In plain English.
So I will just read the
Now we see it.
So if we can go through this when we have, we can go through this but I will just pick one or two things, few things from this article that are very important, so that I will not repeat what I have said. Like I said, various studies have been done in the past, but despite this evidentiary maturity, a critical translational gap still persists, and the field of periodontal medicine remains at the level of qualitative affirmation. Periodontitis is associated with, that, rather than quantitative attribution. That is, how much of this patient's endothelial dysfunction can be attributed to periodontal inflammation. That gap has never been, has been there And that's the gap that this study has instituted. That's what we have been able to find how we're going to move forward from here. Now, like I said, various studies have been done to synthesize risk factors that we can use to match both the periodontal disease and the systemic disease together. The primary objective of this study is actually to synthesize existing evidence and propose a methodology transparent, evidence-informed heuristic framework that translates published PISA outcome association into quantitative estimate of endothelial burden attributed to periodontal inflammation. Yes, I've said something about the biological plausibility, how the periodontal inflammation actually affects the endothelial dysfunction leading to arteriosclerosis and other major cardiovascular diseases. I'm going to, so these are the various, sorry. So the endothelial risk score underwent external scrutiny from cardiology, endocrinology, nursing, alongside internal periodontological appraiser. And every query from each of these departments were evaluated against their core principles. So when we have time, we can go through this, but I just want to quickly go through the predictors that were used for this heuristic weighting. Like I said, the first one is the PISA, which is on the score of 0 to 10 points. Most of the time, PISA is calculated at maximum 5,000 millimeters squared. So, like we know, age is another major factor that is very, very that is attributed to cardiovascular disease. If anything that is less than 50 years, is 0 points. But if it is greater than 50 years, that's 2 points. Sex, 0 point for female, 1 for male. Systolic blood pressure, 0 points. If it is less than 120 millimeter mercury, 1 point for between 120 to 139 millimeter mercury. 2 points for one for if the BP is greater than 140 millimeter mercury. So like that, smoking per year, this is from the lifestyle perspective. If it's a never smoker, we have a 0 points. 1 point for somebody that smoke 1 to 10 packs per year. 2 points for greater than 10 packs per year. That for anyone that has diabetes, that we know diabetes is a major cardiovascular risk condition, which if somebody has no diabetes, it will score 0 points. 2 points for patient that has diabetes. So the rationale is the fact that hyperglycemia usually causes sustained endothelial toxicity. The next predictor is high sensitive C-reactive protein. If it's 0 points, if it is less than 1.0 milligram per liter, and so on and so forth. I will just show us that's a prototype endothelial risk score, and possibly how it's being used. But it is, like I said, for now, it is for research purpose. After the validation process is completed, it can be incorporated for medical and clinical training. For clinical treatments of patients. This is the endothelial risk score, evidence-based informed heuristic score, integrating PISA, cardiovascular risk factor, high-sensitive C-reactive protein, and optional ADMA into sorry. Okay, so like I said, the PISA is the major quantifiable tools for now that could be used because of the degree of inflamed area, inflamed tissue around the gum. And because at that particular time, it is measured as a result of bleeding. When a patient bleeds, there's 6 points around the tooth. When the patient bleeds, there's a way they calculate it and eventually arrive at a particular figure. So for example, if a patient has, let's say this patient has 1,000 or 1,500, and the vascular risk factor, such as age, if it is, let's say it's less than 50 years, and the sex is, if it's male, you said is 1, if it's female, is 0. So let's leave it at male. And as much as, sorry, please, are we seeing the endothelial risk score?
No.
Oh, sorry.
You're still on the
Sorry.
ERS score. Your slide is not moving.
Can we see this endothelial risk score now?
Yes.
Yes. So this is just this is where we impute all those parameters. And eventually, by the time we have that, we can be able to score the patient and have the PISA components and the other. For example, for the patient that I initially did, it was 3,000 PISA, 3,000 millimeters square. And at the end of the day, the person has diabetics, mellitus, 1 to 10 packs per year, and HRC protein has 1 to 3.0 milligram per liter. By the time we did the calculation, the result shows that this patient has 15 points, out of the 24. And that is showing that this patient has high vascular body. When it correlates it with flow mediated dilation, which is corresponding to 3 to 5%. And clearly, we can know that, okay, this patient, this is in level of 13 to 18, needs urgent periodontal therapy, immediate medical referral, joint treatment plan, and 3-month follow-up. That would be the treatment plan, a framework, that will be followed. But like I said, this is not for treatment yet until the validation process is complete, and it's ongoing now. But this AI, this digital health tool, I mean, institution just, immediately, when they immediately institute, incorporates the findings of this study to form this, the calculator that we can easily use for research purposes. On this note, I would like to, if there are questions, I would like to stop here so that we have the time for question and answer. I hope I have not bored you. Thank you.
Thank you. So, oh, that was deep. And you are one of the authors of this research. So if you please take these slides off so that we can have the full screen. Fantastic. Thank you so much for sharing this. This is, in fact, land breaking. It is something very important. Gum disease is quite common. That's, I wish you were using gum disease instead of periodontitis so that I'll be carried along as you were speaking. And the bottom line is it affects the heart and also can be a contributor to somebody developing diabetes. And you have come up with a way to calculate using this calculation or the calculator to calculate how high the risk factor is and then how to intervene. You didn't just do the calculation, but what will be needed to intervene. This is huge. Thank you to you and to your co-authors on this project. I'm really impressed that you dentists are doing stuff like this. It's us that we think, are the research gurus. So
Thank you.
thank you. I'm sure people would have questions. Do you have questions? You can put it in the chat box or raise your hand. Because I know that's what Medical Mondays family does. Any questions? So now this is still in the research stage, correct? And of course, I just saw it. I saw the tool, and I know that it will be very, very useful in the clinical setting. But right now, what would be the advice you will give to somebody who has gum disease? Because they will know they have the gum disease. Something is wrong with their gum or their teeth. What would be your advice to someone like that?
Yes, it has come to time now that we begin to take gum disease very seriously. When somebody has gum disease, occasionally, it now, the age that is happening is very, very important. So if it's somebody that is still under 30, maybe a child, young adult, may see that, okay, maybe this person maybe it's just gingivitis, because gingivitis is the reversible stage where the person can still, if he institute treatments, there's going to be a reversal. There's going to be a restoration. So gum disease, like we use, the periodontitis is the severe, when it begins to get to a level that is irreversible. So anyone that has gum disease, first of all, should find a way of getting himself checked, institute correct treatment plan. Basically, if it's reversible, mere good toothbrushing and a good brushing technique will restore this. But most of the time, there may be some underlying pockets which have now been irreversible. So at this particular time, there is need for professional, what we call scaling all those plaques that are underneath the tissue has to be removed, because the more of those plaques are there around the tooth surface, the more structures they begin to break and get deeper. Eventually, you get to be loading the system with low chronic inflammation. So what somebody needs to do, first of all, ensure that the habit of tooth cleaning is very, very optimal. Then get professional intervention. Let there be assessments, and also doing of scaling and polishing. And for that, we monitor. After that, follow up, look at it. Does this go? I mean, is there any improvement? Most of the time, there's going to be improvement after they've removed the threats or the thing that may be leading to periodontal disease.
Thank you so much. The fact that there's hope, even when one has this gum disease and oral health issues, is very refreshing. Thank you. Auntie Tawa, you have your hand raised, ma. Kindly unmute. You are
I
on
did already. Yes.
mute. Fantastic.
Good evening, everyone. Dr. Opeyemi, good job. But you brought me back to class. I felt I was in medical school.
Thank you.
There was too many medical jargons, and I'm sure many people will just not understand majority of what you say. When you are coming on our platform, remember, most of us are layman. So talk in the language that we will be able to understand. Yeah, but beside that, it was wonderful. And for the periodontitis, if one has it and has a pocket, and the pocket has gone into the bone, they are going to try to do grafting or whatever they try to do. So what part of my question is what Dr. O asked you, because you didn't really deal on interventions. We know that, okay, you have this, you have all this, you have all this, but what can people do? I know that you just talked now about the brushing, fluxing, maybe water fluxing, thread fluxing, and how often do you go to do your cleaning? Can you just touch on all those little ones? I will appreciate it. Thank you.
Okay. Thank you, Ma, for your comments. And sorry again for the medical jargons. At times it has to come with a lot of practice, you know. What is very important is the fact that when somebody has gum disease, like I said, basically the toothbrushing, flossing should do. But most of the time, it is not, by the time people are presenting, it is no longer just gum disease. There are associated bone loss around it. May be mild, may be moderate, it may even be severe. But the severe form is when we are having those association entering into the bloodstream and all those things. So when there are holes, those holes that is being assessed through radiographs, maybe cone beam CT, there are some form of bone substitutes that could be actually be used to replenish those that could be used. Not, I'm talking of professionally now. It's not by individual. So what the individual, most of the treatment that people, after it has been established that somebody has gum disease, needs professional, is a professional intervention. Needs professional intervention, because the more somebody use, maybe some people have used, they are in habit of using maybe toothpicks and all those things, you know. But there are form of bone substitutes that dentists can use to, you know, to fill up the the O's or some other form of treatments that could be what's it called? Could be incorporated. But as far as the hole is concerned, or whatever bone that has been lost or tissue that has been lost, they can be regenerated. And that's where it is important to present at the for professional assessments.
The second part of my question is on TV now, there are just too many things about tooth where you can buy it online and just stick it there and do this and do that. What is your view about all that? Because it's scary.
You know, now because of various interests around the field of dentistry, so a lot of people could come up with various things. But what is very important is that it's just like some of the tooth materials are usually graduated, or if anything that you are going to put on the mouth has to be, you have to first of all measure. Because if those things, the setting of teeth require assessments. And most of the time, when the assessment is not well done, wearing any form of thing can cause damage to long-term damage. Though it may be slightly okay, but long-term damage may be imminent with some of those things without professional assessments, because the tooth way is structured, so many measurements take place in around these teeth that eventually make design of anything, any plan or any treatment plan that wants to do, or any substitute that want to put on the tooth. But I wouldn't recommend that people should just go out and buy or put anything on their teeth without professional advice.
Thank you very much. I appreciate that.
You're welcome.
Thank you. So I have some questions in the chat box and some comments. Dr. Ajay said, gum disease can affect people of all ages, correct? That's a question.
Gum disease, yes, it can affect people of all ages, from pregnant women to old, so it can affect people of all ages, children, adults, adolescents, but at different rates, depending on the age generally. When it is affecting the children, it is called gingivitis, which is what most people refer to gum disease. Gingivitis is just only on the gum, on that gingiva. But when it is proceed more than gingiva, it proceeds into the periodontium. I mean, the periodontal ligaments, the bone, and the cementum, which are the other deeper parts of the whole entire periodontium. So when we say gum disease can affect the whole population, yes, but gingivitis is what affects children, except there are other systemic involvement that make them to advance to periodontitis.
Thank you.
I hope that is clear.
Yes. So it says, thank you for your research and congratulations to you and your team of authors on this important work. Then he said he understands this may be preliminary as the research continues to advance. What demographics, such as race, ethnicity, and age group, have you studied or considered so far?
Most of the for example, most of the studies that we've done in periodontal medicine group are basically among the Black, because they are done in Nigerian population. And what do I mean by that is the fact that the interventional study that we have done, working on COPD patients, working on diabetic patients, they are mostly in Nigerian-based study. But this particular study, this particular endothelial risk score that we are talking about is not based on Nigerian study alone. In fact, it's based on, it's synthesized from various meta-analysis, various review articles. And it is not a Nigerian, not just a Nigerian thing, but the validation process, because of the resources, is limited to, we are going to use Black population. I know the leader of the group, as we have like a connection with Helsinki University, which also also has a lot of diagnostic center that also can participate in this study. So, but for now, the validation that is to be done is in Nigerian population, and subsequent validation in various maybe collaboration with other countries. Also, when we bring all these things together, we can actually sense using machine learning to sensitize the weighting coefficients that could be used to generate a what can be used with different population or ethnic groups.
Fantastic. So, Dr. Lola Adurunke asked, please, what causes sensitivity of the tooth? And what's the treatment for it?
Okay, thank you very much. When there is sensitivity, what actually happens is that the outer layer of the teeth is most likely eroded, or has started to be chipping off. It can be as a result of so many things. Maybe somebody that is that like to chew mouth. For example, excessive chewing of gum can cause sensitivity. Various things, somebody taking acidic drinks, all these lime, these acids, they tend to wear the tooth surface off. And when the tooth surface is being wear off, what happens is that the dentine, which is the second layer after the enamel, is being exposed to azotes. It is this dentine that usually causes sensitivity. And when this occurs, it usually, when this sensitivity occurs, it means that there is an opening of the tubules in this dentinal dentine tissue. So what the treatment for it is to get this sensitizer. There are some paste, we call it the sensitizer. One of the common one that we use is this Sensodyne in rapid action. What that does is to like block those tubes, open tubes within the dental tissue, and ensure that the fluid inside are not exposed, because it is the sensitivity, the fluid that are moving within those dental tissues are what are causing those sensitivity in the real mechanism. But if somebody is having sensitivity, the first thing is to assess, is the person has been taking acidic drinks, maybe lime, or anything that can cause hot food. If you notice that you are taking maybe for now, take disease from those things that are the risk factors. Then use we can get on counter Sensodyne is available on rapid action, can get that. And if it doesn't go, you might need to do a cover. This one might be has to involve a professional dentist to put a layer to cover that tooth, maybe with composites, with other form of materials, just to put a cover on the surface of the tooth so that the drinks or the acidic content cannot enter into the dental tubules.
So Sensodyne toothpaste
Yes,
is helpful,
very helpful. Yeah.
protect or to prevent tooth sensitivity, is what you're saying. Okay. So, oh, Haman, good evening. Haman called in from London. And by the way, our speaker tonight is also in London. So right now it's after 1 a.m. in the morning. Dr. Opeyemi, we appreciate you. So this is your neighbor in London. He said, if the presentation clear on areas that were emphasized, which he really appreciates. He appreciates you. He
Yeah,
said,
thank you, Dr. Eman.
no, he's not a doctor. He's not, he said he's not a
Okay.
medical practitioner,
Ama, thank you. Thank you very much. Yes.
but that he learned a lot. Currently undergoing treatment with his dentist in the UK.
Oh, really?
Treatment, yeah.
Okay.
Yeah. And then Dr. Alu says, thanks for your insightful presentation. Does brushing regularly with nitrogen peroxide and baking soda prevent gum disease? Excellent question. Because Dr. Jagbe has preached that a lot on Medical Monday. Dr.
Is
O.
it nitrogen peroxide or hydrogen peroxide? I want to confirm.
Sorry, it should be hydrogen peroxide.
Okay.
Sorry, and I just read what was written. It is hydrogen peroxide and baking soda, I think he wants to write.
Well, there's a controversy in the literature with respect to use of hydrogen peroxide, and it's very, very cheap actually when it comes to use of it's cheap, it's easy to use. But one thing that's been found with hydrogen peroxide is it tends to cause tissue. It's called tissue emphysema, so that it burns tissue. But when it comes to the issue of the effectiveness of hydrogen peroxide, is very, very effective because of its ability to release what is called nascent oxygen to the these anaerobic organisms. So with that understanding is effective. But most of the time, professionally, I will not want to recommend hydrogen peroxide because of potential tissue burning. I've seen patients presented with hydrogen peroxide use. I've seen the whole teeth just blanch off. So it happens. But with little, if somebody has a way of applying a little hydrogen peroxide into a cup, probably to an extent we take care of gum disease. But I will not stick out my advice on the use because of the tendency of overuse. And when it's overused, it's going to burn the tissue and cause more damage to the tissue. But having said that, it is very, very effective. It's actually effective depending on the concentration to deal with periodontal organism. But professionally, we don't really recommend. We have these debates back and forth with respect to hydrogen peroxide. Well, I know it's easy to use. It's easy to use, but maybe probably because it's cheap, people would like to get. May it may be important for people to get something that is more medically recommended.
So I get it. Hydrogen peroxide can burn tissue in the mouth. Dr. Jagbe preached this to us a lot. The hydrogen peroxide and baking soda, that it prevents gum disease and all those other ailments. Well, just to break this down to our audience, when it talked about anaerobic bacteria in the mouth, the bacteria that usually thrives there is anaerobic, meaning they don't need oxygen, correct? Is that a direct interpretation of that?
Yes, they thrive in a low oxygen tension. They don't like oxygen. So when
Exactly.
you use any substance that releases oxygen to them, you have deactivated them. They are killed immediately. So that's it. That's that.
That's that. And that's the reasoning behind the hydrogen peroxide, according to Dr. Ajagbe, because
Being
when
useful.
oxygen, sorry, it will break down into water and oxygen
Yeah.
when it's put in the mouth, and that way it kills the bacteria.
Yeah.
Thrive in environment that has no oxygen. So that's the reason. But thank you for letting us know that it is not standard operation or standard recommendation in the clinical setting for now. Auntie Tawa, you had your hand raised before, ma. I saw it. You know, I will let you go.
Yes, I did. But exactly the same thing that I wanted to ask him was about the hydrogen peroxide. And I think AJ or somebody asked that question because he mentioned that anywhere acidic and hydrogen peroxide is acidic. It may not be very strong because most of the one that is sold on the counter 33%, not 100%. But they are in some of the toothpaste, and baking soda, they are in some of the toothpaste. So why do they have them in toothpaste if they can damage our gum?
Yes, this most of the time, a lot of these days you have various kind of toothpaste. People incorporate so many ingredients to them based on their interest but when we look at the tooths generally, like I like the way Dr. Professor Jagbe usually adduce the fact that when you want to brush teeth, it's like a glassware. Even mere use of a tooth brush can do some degree of cleaning. But what is in that toothpaste? Something that like that are particles that can rub the surface are very, very important. Number one. And number two, fluoride is very, very also important because fluoride tend to remineralize the tooth tissue somehow. That's why it always tends towards going for fluoride. But we know that there are many toothpastes nowadays with various, some may not even have fluoride. but yet they still do the job. It depends on what somebody is looking for. But medically, we always recommend a fluoride containing toothpaste for toothbrushing. Not that other items or materials are not useful.
Thank you very much.
Thank you. Haman says, thanks for your research, which you and your team have brought to us, and the demographic of this study. So, Honorable Alvin
Thank you.
says, Dr. Adewole, thank you for the presentation. Your views on general use of oral mouthwash to kill germs, considering the fact that some of these germs can be protective. So let me repeat, what are your views on the general use of oral mouthwash that is used to kill germs, and is asking this considering the fact that some of these germs can be protective?
Okay. With respect to disease generally, we know that the bacteria are the organism they cause infection. But we have the bacteria that are called normal flora because they reside in certain areas of the mouth to protect the mouth. It's fine. But what happens is that when there is balance between the normal flora and there are no intruders, health is achieved. But as soon as there is distortion around the normal flora, such that as a result of what we call all these maybe virulent anaerobic bacteria, those bacteria that love, that don't like oxygen, they begin to distort the population and cause disease. After disease has been formed, now it doesn't look, because the more you use what do you call it, mouth rinse, it tends to take, definitely it's going to take a lot of bacteria along. So use of mouth rinse is recommended, but excessive use is not, because of the fact that it's going to do damage rather than restoring the normal flora. It will be wiping them out, and eventually these are the things that are supposed to be protecting the body, the soft tissue, from damages that should have been caused by other form of foreign or external bacteria that cause diseases. So I hope I don't know if I have answered that question. So no, excessive use of mouth rinse can eliminate the normal flora. Yes. So it is not, most of the time, if you want to use a mouth rinse, maybe because of odor, or use it for maybe 2 weeks. After 2 weeks, you should stop, so that you allow the repopulation of the normal flora. But it's continuous use of normal flora, I mean, it can even lead to can lead to tooth discoloration and all sorts of malodor, because the real protective bacteria have been eroded or be deactivated. Thank you.
Thank you. So, Dr. Ajay says, we wish you all the best and want to promote our very own. He believes we can soon collaborate with dental schools here in the US and Ghana to support your research and identify potential volunteers.
Yeah, that would be great.
Good news out there and promote this great work. Good job.
Thank you.
See, they're thinking ahead for you.
Yeah.
Aman, oh, it's 1:13 in London. Another warm day. Should be 1:26 now, a.m. in the morning. Pastor Paul says, most grateful for a very impactful and professional, comprehensive presentation.
Thank
Thank you.
you.
This has been awesome. Learning more about dental health and, even you discuss some interventions. So we all wake up in the mornings and brush our teeth. Hopefully that's what we do. It's also recommended that we floss and brush our teeth at night before we go to bed. So what's your take generally in dental care?
Generally, because I will always recommend preventive measure first. Preventive measure is the key, because we cannot afford to leave our dental care to for curative therapy, because when the teeth begin to damage, there are a lot of we tend to spend a lot of money, and it also affects a lot the quality of life. So I will, for dental care, the first thing that I will want to encourage people to do is preventive measure. And when we talk about preventive measure, like we said, the adequate flossing, brushing of the teeth, probably most times twice daily, and
Twice or three times?
twice daily is okay, because the essence of the twice daily is the fact that when there are some food particles that bacteria or microorganisms can be feeding on, will be reduced. So that's the essence of the twice daily. So even if you don't put paste, after finishing food, you use your toothbrush to just brush away the food debris, is okay. And flossing. Flossing the food debris that may not be removed, or plaque that may not be removed by tooth, the floss can remove them in between the teeth. So that's being said. And also, if you ensure that the mouth is well hydrated, take a lot of water very well. Is very, very important. It make the mouth to be moisturized. So, and as soon as we notice that maybe there is a bleeding, go for checkup. Constant checkup, we make a difference. Every 6 months, it depends on the risk. If we are somebody that form calculus, this tartar on the teeth, more, they form it, the rate at which people form it are different from one another. Make sure that if it's 3 times in a year, or twice in a year, we go for it. And as soon as we know that there is any systemic components, we ensure that the systemic component is taken care of with attention on the periodontal disease, so that the burden of systemic disease is not more as a result of periodontal component that is not taken care of. So that's what I would like to say. And then various risk factors that contribute to periodontal disease, also such as diets, are very, very important. We watch what we eat. Most of the time, the refined sugars contribute more than we can think of to the inflammatory load around the periodontal tissues. So it's very, very important. Avoid the issue of smoking. Smoking is one of the major culprits. that can limit, that can rapidly destroy periodontal tissues. If you start by reducing the amount of blood that are flowing into the supporting tissue, okay, and when we notice there's need for us to avoid smoking and most of the time alcohol drink, every form of lifestyle that potentiates our inflammatory states, we should desist from it. Lastly, avoidance of stress. Stress is one of the major culprits that contribute to the chronic inflammation that we have. All these things work together to eventually increase the inflammatory burden that not only affect the periodontal tissue, that also affect the systemic health generally. So avoidance of stress. Sleep well. You might don't know how good sleep can affect periodontal health. All these habits, all of them work together to ensure that we can prevent chronic diseases, of which periodontal disease is one of them.
Thank you. Sister Ellen Toppin says, not sure if you answered this question already. What could cancer patients going through treatment, for example, chemo, do to protect their teeth and to deal with mouth sores, etc.? So
Wow.
patients going through chemo, I know it's
a patient going for chemotherapy, they have they are being predisposed to a lot of medical oral lesions, actually. So it's very, very important that they have assessments done along their therapy. They should get assessment done to know the state of their oral health, oral health condition. If it were around, because some of the radiotherapy or the chemotherapy can be associated with dry mouth or things that make the excessive dryness of the mouth that can predispose them to further disease. So it's very, very important for them to go for checkup, always ensure that there are no infections around their teeth, because if they have infection around the teeth, it will get worse as a result of those therapy. Because if there is dry mouth, for example, there's dry mouth and the person is not taking fluid, he's not rehydrating himself well, it's going to come up with all sorts of ulcers, sores in the mouth. So, like I said, constant professional reviews and intervention are very, very important. If there are holes on the teeth need to be filled. If there are pockets around the teeth, it needs to be, especially we should ensure that there are no infection ongoing that can further worsen the condition of the patient. So it's very, very important. I know it's a lot of burden for people with cancer patients whenever especially if there are dental components. It can be very, 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 very annoying and challenging, but they are manageable.
So another question from Dr. Alu. Is the use of toothpick recommended? And do you have home remedy for removing plaques?
Yes, like I mentioned the other time, when it comes to the issue of toothpicks, the toothpicks are use of toothpicks. There are toothpicks that are designed toothpicks that such that the triangular surface, the edge is designed to always land in between the teeth, rather than causing a hole in going down the on the vertical structure of the tooth that will be causing permanent damage. So toothpicking habits tend to weaken and weaken the supporting structures. But they are also designed, instead of using toothpick, I would rather recommend that people should use of dental floss. Dental floss are very potent instead of using tooth, because the thread always lands in between. The thread will always land in a horizontal position, unlike toothpick that will always go down in between the teeth and causing more exposure of the root surface, which will allow the virulent organism to cause more damage to the supporting structures.
Thank you.
Even mere using of brush too, because brush also can be used to remove plaque without even, the brush can be used to remove plaque on many occasions, other than the use of toothpick.
Remedy.
Yeah.
Remedy for removing plaques was the other option. Home remedy. Other
Water,
than
we can also use water. Use of water. There's this water pit. Can use water, but most of the time, to remove plaque is toothbrushing, use of dental floss, as much as possible.
You are right. How about the tongue brushing? We cannot talk about this oral health and not talk about when you brush.
Yeah, you brush it. Yeah,
Brush.
it's very, very important actually, because the surface of the tongue are coated in a way that this bacteria can actually hide in the crevices. So brushing of the teeth is not complete until the tongue is brushed. You have to brush the surface of the tongue as much as possible. So it's very, very important. Thank you for that contribution.
Thank you. So Sister Ellen Tappin says, thank you. Said, what are your views on charcoal toothpaste versus the traditional white toothpaste? He talked about Sensodyne before. So what are your views on charcoal toothpaste versus the Sensodyne toothpaste or all the other traditional white toothpaste?
You know, initially, Sensodyne was designed for sensitivity, you know, as along the line, when the company know that a lot of people are really going for toothpaste, so they now make it incorporated into like a routine daily use Sensodyne as toothpaste. It is still okay, but the use of charcoal toothpaste is not recommended. Why? Because of the abrasive nature of charcoal. It tends to wear the enamel surface, which can predispose that person to sensitivity later on in life. And number two, most of charcoal toothpaste, they don't have fluoride. It's like as they are wearing away the tooth surface, there is no fluoride, what do you call it? Remineralizing the enamel surface. So use of charcoal is like somebody is using glassware to rub glassware. So the charcoal toothpaste are not recommended for brush. Although I know a lot of companies are making it because of patient interests. So, but professionally, they are not recommended based on those abrasive nature of this toothpaste and long-term effects, damage that will cause, they will cause to the tooth surface.
Doctor, you're muted. You're muted. We can't hear you.
Oh
We
my
can't
God.
hear you.
I've been talking. Thank you so much. Thank you. I said, Dr. Alu says much appreciated to both of us for another great informative episode. And Sister Toppin says thank you.
Thank
And
you.
in that in London right now, it's almost 2 a.m., correct?
Yeah.
Yeah, and you stayed up to just bless. Thank you. We appreciate you. So we want you to go rest up though, because tomorrow is still work day. What would you leave with us as parting words? What should we remember from this session in the care of gum?
Thank you very much. It's a great opportunity for me to remind us again that when we talk about the oral health, we should think about our whole body at the same time. It's not separated. And that's first thing. We think about it as essential parts of our health. Now, and also we should think about prevention. Prevention, prevention, prevention. We should identify all those risk factors that we have outlined, the blood pressure, the blood pressure, the what do you call it, lifestyle, the other things that we talk about in preventing periodontal inflammation. All those things are very important. But more importantly, the systemic diseases. The systemic diseases are, as they have a lot of link. These days, it is easy to omit the dental aspects. So it's very, very important that we don't neglect our dental condition, especially when you know that there is a compromise with respect to systemic conditions. So it's very, very important. And then most of the time, we avoid all forms of stress because both dental, it is very logical for us to look at it on the prevention of the common risk factors, things that we potentiate chronic inflammation in the system. As much as possible, you should look for how to eliminate them. With this note, I would like to submit to us that periodontal disease, it has gone beyond the issue of association now. Now we are looking forward to a new era of incorporating it, looking possible incorporation into treatment of clients, of patients, as far as is, as much as possible, because we treat a whole human being as a whole, not in parts. periodontology, cardiology, endocrinology. We have to work together to ensure that we reduce the burden of diseases that affect us as human beings. Thank you very much.
Thank you so much. We appreciate you. Thank you. God bless you.
You're welcome. Thank you.
Medical Mondays family, you've heard. Till we meet again next week, please stay safe. Thank you all.